Age-related macular degeneration is one of the leading causes of irreversible blindness for those over 50. So, naturally, it can be a little bit difficult to discuss because it can seem kind of bleak. But I think it's so important to talk about because there are ways we can reduce our risk, slow progression, and there's something brand new on the market that could be life-changing for some people that I just can't wait to discuss. So, let's get started. Age-related macular degeneration also goes by the names AMD or ARMD. They are all the same thing. What it's describing is an age-related change that occurs in the macula, which is part of the retina. Now, the macula doesn't really look like this, a yellow splotch at the back of the eye. It actually looks more like this. This is a normal macula without macular degeneration. You can see it has a nice, smooth color to it, and it comes to this little point in the center. Over time with macular degeneration, this area starts to develop yellowish-like deposits, and it can actually atrophy over time. So we'll talk about that a little bit more as we go. What you need to know is these changes happen usually later in life. They're typically diagnosed in early stages in the 50s or so, and it does progress over time. But there are risk factors that we can control, and we're going to be talking about those in a little bit. Getting diagnosed with macular degeneration for the first time could look different depending on the person. If you're somebody that goes to your regular annual eye exams, then you may find out that you have early signs of macular degeneration well before it even starts to affect your vision. The doctor may notice just a few of those yellowish deposits we were talking about in the area of the macula at the back of the eye, and they will let you know what they find and the symptoms to look out for, and they will probably make some recommendations to make sure that you're following a lifestyle that will reduce the risk of rapid progression, and they may recommend some over-the-counter supplements that we'll be breaking down in just a little bit. If you're someone that doesn't go to the eye doctor often, it may be your symptoms that have brought you in for the exam, and your doctor will evaluate the entire eye with a dilated eye exam, and they'll see the changes in the macula and be able to let you know then. Let's break this down a little further because there are two different types of macular degeneration, and the disease in itself ranges greatly in severity. What you mainly need to know is that this affects your central vision because the macula is responsible for the center of your vision, and the rest of the retina is responsible for your peripheral vision. So why would these changes just happen in the macula and nowhere else? Well, I'll break that down a little further. About 80% of people with macular degeneration have what's called the dry form of the disease. The other 20% of people will develop what's called wet macular degeneration, and this is where you have new blood vessel growth in the macula that can lead to bleeding and swelling. That's where it gets the name wet from. You can't go from having dry macular degeneration to wet macular degeneration. Sometimes the disease progression looks like mild dry, then moderate dry, then severe dry, and then wet. But some people can go straight from having mild dry macular degeneration to having wet macular degeneration. Macular degeneration happens because the retina is extremely metabolically active. If you think about everything your body does to function on a day-to-day basis, there's so much going on just to move little muscles here and there. But your eyes, they're open all day, whether you're sitting or standing or running or jumping. They're constantly working, even if other parts of your body are at rest. If you're looking at something, your eye is having to register that and send that signal to the brain. And then a millisecond later, when you're looking at something else, your eye has to register that new image. And there's always things coming in and out of our visual field that we're having to tell our brain about, or our retinas are having to tell our brain about. So the eye is constantly receiving and sending information. And in order to do that, it's having to constantly renew components that send these signals. So an eye that is functioning properly is constantly having to recycle the components that are used to receive and send signals. But in macular degeneration, there are things that are left behind. They're not fully recycled, and they start to build up slowly behind the macula. And that's where the doctors look in and they see these little yellowish humps. It's kind of like clutter or old newspapers in your home rather than sending them out to the recycling bin. What happens is these little bumps eventually get in the way of visual function. And since the macula is responsible for the central part of your vision, and it's the most metabolically active part of the eye, this is the area that is most greatly affected, which is unfortunate because for people who have severe macular degeneration, they end up missing the very central part of your vision, which is also the part that's responsible for seeing fine detail and helping to really clarify things and to see color really well. The peripheral retina is able to see, but if you try to read a letter with your peripheral vision, it's going to need to be a lot bigger for you to see it than if it were right straight in the center of your visual field. This is where macular degeneration can make things a little bit difficult. But fortunately, there are some devices and specialists available to prescribe those devices that can help to maximize the vision that remains, and we'll talk about that soon. Wet macular degeneration occurs when new and abnormal blood vessels grow behind the macula, and these can start to lead and cause bleeding and swelling in the back of the eye, and these symptoms tend to be more severe than the dry macular degeneration symptoms, but there actually have been ways to manage wet macular degeneration that have been around for quite a while now, whereas dry macular degeneration has never had any sort of treatment until now. Wet macular degeneration does tend to affect vision at a greater level than dry macular degeneration in the majority of cases, but the treatments that are available have really helped to improve the outlook there. Macular degeneration progresses slowly over the course of many years, typically decades. And unfortunately, the damage is irreversible. So it's really important to know about the diagnosis early and take steps to slow the progression. We'll talk about what risk factors there are that you can control and what's available to help slow the progression of the disease. The symptoms of macular degeneration vary depending on the severity and whether you have the dry form or the wet form. So we'll break it down based on each diagnosis. Early symptoms tend to be subtle, usually reduced night vision, reduced contrast sensitivity. Contrast sensitivity describes your ability to distinguish the subject from the background. So if you're looking at a black letter on a white screen, that's pretty easy. You don't need to have too great of contrast sensitivity to see that. But if the black letter gets to be a lighter gray and the white background gets to be a darker gray, the more similar those two are, the more difficult that's going to become for someone to distinguish who has macular degeneration. And someone in the early stage may also experience slight central blur. For someone with intermediate dry macular degeneration, they may experience those same things, but just to a greater level. Colors may start to look more pale. For someone with late symptoms or severe macular degeneration or geographic atrophy, where the whole area of the macula, rather than just having those yellowish spots, looks kind of eaten away more or less, they will have a large area of central vision that's missing, and they may have trouble even seeing the biggest letter on the eye chart. For wet macular degeneration, these symptoms tend to happen very quickly and progress in a rapid manner compared to the very slow progression of the symptoms of dry macular degeneration. Aside from the other symptoms that I already mentioned, the really important change for people to notice here is when their vision becomes distorted. So if you've been diagnosed with macular degeneration, I'm sure your doctor gave you something called an Amsler grid for you to look at. And if any of the areas of this grid start to go missing, or if the lines look wavy or irregular, then there may be bleeding or swelling in the back of the eye that's causing a change in the macula that reflects in a change of the way that you see centrally, where straight lines will now look wavy. It's really important to treat this rapidly because the sooner you treat it, the sooner you may recover vision. Though vision may not be fully recovered, the prognosis is definitely better rather than waiting, and it helps to reduce scarring. Let's talk about what you can do about it. Risk factors are something that makes developing a disease more likely, and there are certain risk factors that are absolutely under our control. So let's break those down. These first few risk factors can be kind of intertwined, so let's tackle those first. You are at higher risk of developing macular degeneration if you eat a diet that's high in saturated fats like meats, butter, cheeses, you have high cholesterol, high blood pressure, heart disease, are overweight, or if you smoke. The others we certainly can't control. If you are Caucasian or have a family history of macular degeneration, or if you're above the age of 50, you're also at a higher risk for developing the disease. Now, this is where I think that serenity prayer can come in handy. Grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. This is where, if you have macular degeneration, or if you know you have a family history, or if you're just concerned about your overall health, trying to control the risk factors that I previously mentioned that are controllable is the best way you can go about trying to prevent the development of this disease. Of course, we can't change our age or our genetics or our family history, so we just have to be willing to accept that and to do all of the other things to try to keep our eyes as healthy as we can. And of course, wearing sunglasses to protect the eyes is so important always, and especially in macular degeneration. If you were just diagnosed with macular degeneration, you may be wondering, how often am I going to have to go in to see my doctor? What types of testing are they going to be doing? It may just be a little bit overwhelming, so I'm here to break that down a little bit. If you have a mild form of macular degeneration, you may just be seeing your doctor every 6 months or maybe even just once a year. But as the disease progresses, the more frequent those exams will become, and they may be occurring every couple of months or even every month if there's been a recent change, like a new diagnosis of wet macular degeneration. Now, if you have a more severe stage of the disease, and especially if you have wet macular degeneration, your doctor will refer you to a retinal specialist. Retinal specialists are ophthalmologists that are highly specialized in the retina, and they are the ones who administer treatments for wet macular degeneration, which we'll be talking about shortly. A typical exam with your optometrist or your general ophthalmologist before you ever refer to a retinal specialist will usually look like a dilated eye exam where they'll shine bright lights into your eyes so they can look into the eye themselves, and then they will likely take images of the macula with an OCT or other imaging device. And this is very helpful for monitoring the disease progression over time because they can lay the images side by side and they have measurements of the thickness of the macula that they can monitor for changes. There are also types of images out there that can help to diagnose things sooner than what the naked eye can see. And this is really important in somebody who may be about to develop wet macular degeneration, but sometimes you can't see these new tiny little blood vessels growing. And sometimes even the typical OCT imaging doesn't pick up on these. They're just not visible. So this is where fundus autofluorescence imaging can come in handy. And this is a little bit newer to the game, but it images in a different way. And this can help to catch those changes sooner. There's also the possibility that your doctor may use fluorescein angiography. This is typically seen more in those retinal specialist offices, but other offices can do it as well. And this image is taken by injecting through an IV fluorescein and then taking an image of the macula as the fluorescein goes through the eye. It helps to highlight changes that are happening there in the blood vessels and give us sooner notice if there are changes occurring there. The fundus autofluorescence is cool because it doesn't require IVs, so the side effects aren't there, like possible pain, redness, rash, nausea, vomiting. From a patient's perspective, it's like having a very, very bright camera take an image. But the downside to this compared to the IV fluorescein angiography is that the signal strength is about half that of the fluorescein angiography. So the imaging that comes out may not be quite as helpful as it could be, and sometimes it can be affected by various factors like the presence of cataracts, or really dry eyes. So it really is going to be up to your doctor and yourself which route you're going to take here. Now, in my experience, I've never worked in an office with fluorescein angiography. In general, it really isn't commonly done unless you are at the retinal specialist's office. But the fundus autofluorescence imaging is becoming more popular and better over time, and I think that will be quite helpful. Let's talk about how macular degeneration is managed and treated. Number one for everyone, regardless of dry or wet or severity, should be to monitor their vision with an Amsler grid every day. It looks like this. Your doctor should instruct you on how to use it and what to look out for. Monitoring with an Amsler grid daily is important to catch changes early, which is more important now than ever thanks to some new developments I really decided to discuss in just a moment. Let's start with dry macular degeneration. For the early stages, there is no treatment, and this is where managing the risk factors is very important. And there are some over-the-counter supplements that can help to reduce the rate of progression of the disease. You might have heard of AREDS or AREDS 2, and these supplements are just named after the studies that were done. Age-related eye disease study is actually what it stands for. I'd like to focus on AREDS 2, and you'll see in just a moment why that is. AREDS 2 contains vitamin E, vitamin C, lutein, zeaxanthin, zinc, and copper. It's important that your body has plenty of these vitamins and nutrients available, because if it doesn't have those readily available, it will take from stores in certain areas of your body. And the macula is an area that stores lutein, zeaxanthin, among other things. And so if your body is lacking in those, it is going to take from the macula. So taking these supplements helps to make sure that your body has what it needs and doesn't need to borrow from an area where those vitamins are going to be extremely important. So these supplements are available over the counter, but it is important to discuss with your doctor what would be ideal for you. And the reason I say that is everyone is so different. There's no way that I could 100% generalize and say, you should be taking AREDS 2. Just doesn't work that way. And your doctor knows your personal health history and can best guide you in what you need. It's important to know what supplements are ideal for you specifically because we'll look at the example of the original AREDS before AREDS 2 came along. In the original AREDS study, the supplements that were used contained beta-carotene because this was thought to be good for the health of the macula. However, there was a negative effect to having beta-carotene in this supplement. It was found that people with a history of smoking, current smokers, or a history of working with asbestos had an increased risk of lung cancer if they took this supplement that contained beta-carotene. So AREDS 2 was the second study that was done without beta-carotene and did not show these negative effects. So it's good to research and know what you're taking ahead of time and to talk with your doctor about what's best for you. For those with the advanced stage of dry macular degeneration, there is a new drug on the market that I'm so excited to talk about because before there was no treatment available and now there's something out there and it makes me even more hopeful for the future what they may come up with. This new medication is called Syfovre, and what it can do is slow the rate of progression of geographic atrophy. It's important to realize that this doesn't reverse the changes that have happened because of macular degeneration. It can only help to slow the rate of progression. And this is why it's all the more important to have regular eye exams with your doctor and follow up really quickly if you notice any changes. The dosing regimen for this medication is every 25 to 60 days, and it's administered as an intravitreal injection, which means it is injected directly into the eye. And the eye is numbed prior, and though there are always risks of side effects, it's not quite as scary as it may seem. But there is a way to try to prevent this adverse reaction from happening. That is, making sure the person truly has geographic atrophy going on. If the person looks like they may develop geographic atrophy, but they haven't yet, a fundus autofluorescence image can help to tell us if the geographic atrophy is actually starting but in a way that we can't see yet with the naked eye. So it is important to be sure with imaging that this person truly has geographic atrophy before starting to treat it. I'm sure this sounds a little complex, and that's why it is 100% a decision to be made with a discussion between you and your eye care provider. The best people to talk to are your eye care provider and your retinal specialist when you're moving forward with any treatment. I'm here to inform you about the disease itself and these new developments, but I really want to be sure that you discuss with your doctor and make the right decision for you. Something that I find comforting here is that if you do end up developing the wet form of macular degeneration, whether it's as a result of an adverse event from this medication or if it just happened naturally, the treatment for wet macular degeneration is actually quite similar in its administration and its frequency. Now, the cost of this medication at the time of me recording this video is about $2,000 per vial, and this would depend on insurance, and there's so much complexity to that I really couldn't estimate what any individual's cost might be, but I don't want to leave that out because that is quite the important detail. For wet macular degeneration, there are actually a few treatments that are available for intravitreal injection, which is administered the same way as the drug that I was just talking about, and sometimes a laser is used. Both of these treatments aim to reduce the number of abnormal blood vessels, slow down their growth, and limit the amount of swelling or bleeding in the macula to preserve vision and reduce distortion. Typically, for wet AMD, patients are treated on a monthly basis initially for about the first 3 months, and then every 8 weeks to 3 months, depending on the person and how the disease is progressing. So this dosage frequency can really vary depending on the individual. Now, there are various medications available. Some are brand name and some are generic. So the price per injection can vary from just a few $100s to over $1,500. It really depends on insurance as well. I always hesitate to discuss costs because it's so variable depending on so many factors that aren't just limited to what country or state you live in, or the fact that companies can change the cost of medication from one day to the next. It's just impossible to estimate. The best way to find out what your examination may cost is to reach out to the provider that you're planning on seeing to discuss the anticipated costs that may occur during the exam, including any tests that may be done or treatments that may be done. Of course, going into an exam and just speaking to someone on the business end of the practice versus the doctor, and even the doctor themselves couldn't tell you what is going to be going on, what diagnosis you're going to have, what treatment would be best for you, what tests would be best for your specific treatment, depending on the specific findings. There are so many factors that it's impossible to anticipate what the cost would be of an exam. And then there's always getting the actual tests and treatment done and then billing it out to insurance and seeing what they actually cover, which is another factor that's just really hard to estimate. So therein lies one of the greatest problems of the insurance and healthcare system, at least in the United States. And I wish I had a better answer for it, but that is one of the reasons I don't discuss cost too much in my videos. So best to call your insurance provider and your care provider and try to estimate it as best you can from there. Finally, there is another way to manage macular degeneration that's not just about treating the disease and slowing the progression. Macular degeneration affects people very differently depending on the severity of the disease, whether it's the dry form or the wet form, the location of areas of atrophy and the size of those areas as well, and how well each individual responds to the treatment. Aside from these adjustments to risk factors and lifestyle and treatments that I've already mentioned, there is another way to manage the disease. We have talked about how macular degeneration is an irreversible loss of vision, but there is hope out there even for those who have lost large areas of their central vision. We have to remember that there still is peripheral vision available, and this can be utilized and optimized to try to help someone live the best possible day-to-day life that they can. A goal of vision rehabilitation specialists is to help someone maintain their quality of life and continue to do the things they love that require their vision. There are a lot of different strategies to try to maximize someone's remaining vision to help them do their day-to-day tasks. And these could vary greatly from very simple things to just wearing different types of glasses depending on what activity you're working on. Some people can get very strong glasses that require them to work very up close, but it helps them to continue to be able to read, for example, or magnifying glasses can be used. There are magnifying glasses with built-in lights. There are electronic devices that help to significantly magnify images, and these could be on a small scale, kind of like a tablet size. There are even ways to use your cell phone and change the accessibility settings on there to function in a way that will help someone see better. There are also grander scales like CCTVs where you can scan over something and it's projected onto a large screen. And these screens can even change color in an instant with the click of a button rather than being just black and white. They can have different contrast colors like blue and yellow. And for people with trouble with contrast sensitivity, this can really help them to see better than if it was just that black and white. There are also wearable devices that are available, and they're always trying to come out with better and better things to help people continue to do what they love to do regardless of their vision loss. It's important to remember going into an exam with a vision rehabilitation specialist that they cannot bring back the vision that is lost. They are working with the vision that is there using these devices to maximize it. And they specialize in doing that compared to your general eye care provider. Some of these doctors spend hours at a single exam face to face with an individual patient, working with them, examining their eyes, doing various testing, working with them on which devices are going to work best in their circumstances, and treating them on these devices and testing them out to see which they're going to be able to work best with when they get back home on their own. There may be a follow-up appointment or two, but once the devices that the patient are going to use are determined, they often don't need to return to the specialist unless it's annually or maybe on an as-needed basis. Because the setup of these examinations is so different and it can be sometimes difficult for a doctor to accomplish what they need to within the realms of the rules of insurance, sometimes this type of specialist doesn't take insurance, so it may be an out-of-pocket expense. So that's something to be aware of going into it, but it's very worth at least considering, especially if you think about what your expectations are. Thank you for watching this video. I hope it gives you a good understanding of what macular degeneration is, what to look out for, and what to expect from possible future examinations, appointments, and treatments. And I hope it gives you a little bit of hope of what's out there and what hopefully will be out there in the future as new treatments and ways to manage the disease. As always, I hope this empowers you to learn more about your healthcare and take an active role in that with your provider in order to seek out the best treatment for you. Thank you for watching, and I'll see you next time.